Our Time Banking for Respite, an innovative and socially just approach to supporting family caregivers. We are going to be recording this webinar. So you will receive a link to it in the next day or two if you want to share it with your colleagues or listen at another time. My name is Jill Kagan, and I am the Program Director of the ArchNet. Slides in a PDF format for today's presentation are in the materials box in that right-hand side of your screen where it says TimeBanks Webinar. If you click on that and then click Download, you will have your own private copy of the slides themselves. The Federal Lifespan Respite Program has now been up and running for almost 7 years. With 33 states and the District of Columbia receiving grants since 2009 to actually implement lifespan respite activities in their states. There are some states that have been actually implementing lifespan respite much longer than that, some for as many as 17 years, programs that were developed voluntarily or through their own state legislation. And with all these efforts, the grantees and their partners in the states have been developing innovative ways to increase capacity to provide respite services to more family caregivers, especially those caregivers who remain unserved through more traditional approaches or who just don't qualify for any existing federal or state funding streams. The Lifespan Respite programs have been exploring this through mini grants to community-based agencies to develop new innovative models for respite, reaching out to the faith-based organizations to partner around respite, recruiting and training respite workers and volunteers, developing consumer-directed planned and emergency respite vouchers that help families and family caregivers pay for respite. And looking now, we're spending a lot more time developing some tools to help families identify natural supports and inclusive activities in their own communities that can help provide respite. And so we're very pleased that in the context of this that we have been working with TimeBanksUSA to explore ways that we can work together to make respite more available through this time-honored and evidence-based approach. And of course today you're going to learn a lot more about what time banking is and what it means. I am very pleased today that we have with us Dr. Edgar Cahn. He is the CEO and founder of TimeBanks. Dr. Cahn is also currently a distinguished professor of law at the University of the District of Columbia School of Law. Time banking, which you're going to hear more about, is a currency that rewards decency, caring, and social justice and is now in use in at least 40 states and 34 countries. Of course, you're going to be hearing more about that, as I said today. Dr. Cahn also founded the Racial Justice Initiative, and he is the co-founder of the National Legal Services Program in the War on Poverty, the Antioch School of Law, and the Time Dollar Youth Court of Washington, D.C. He's written many books, including Time Dollars, No More Throwaway People, and Priceless Money. And in his long and distinguished career, Dr. Cahn served as speechwriter and special counsel to Attorney General Robert Kennedy and was the executive assistant to Sergeant Shriver, director of the Office of Economic Opportunity. We are very honored to be working with him and especially honored that he is with us today. Some of you may have been privileged to hear Dr. Cahn speak at the Arch National Lifespan Respite Conference in Tennessee a few years ago, and so you got a taste of time banking concepts as well as Dr. Cahn's motivation to build this program nationally and internationally for caregiving in particular. Edgar is joining us all the way from England today, so we're hopeful that the technology that he's participating on will continue to support his being able to speak with us today. Our next presenter is Dr. Christine Gray, and I am equally honored to have her with us. Since 1999, Dr. Gray has worked with Dr. Cahn and with time bank coordinators around the country to develop time banking as a tool for community building and social change. She was the chief editor of Dr. Cahn's No More Throwaway People. In partnership with leading time bank coordinators, she developed the first hands-on time banking training and numerous international time banking conferences. She's developed and facilitated many workshops and retreats for grassroots groups, nonprofit staff and management, and policymakers to explore and apply time banking not only in the United States, but in Britain and South Korea as well. And for a short time, she served as executive director of TimeBanksUSA. Most recently, she's overseen the development of Community Weaver 3, which is TimeBanksUSA's latest time banking software. I want to thank both of you for agreeing to present this webinar today. We're really delighted that you are able to take the time to do that. So I turn it over to you, Chris, to begin your presentation whenever you're ready.
Okay, well, thank you so much, Jill, and hello, everybody. It is a great pleasure to be here, and to be here with Edgar, who is, as Jill said, actually in Wales. I'm not even sure where he is right now, so I'm going to step back just for a moment just for Edgar to say hello, and then I will we're going to coordinate as best we can with Edgar being in Wales and me being here and he not being online. But I think we'll manage that, and I'm going to pass over to him, and then he'll hand back to me so that I can go into the first slide and a first question. So Edgar, over to you.
It's good to join you even across the ocean. I'm actually meeting with groups of people who are overseeing caregivers and who are overseeing a national network of caregivers, and they tell me it is as underfunded here as it is in England as it is in the United States, that the magnitude of the need is vast, and they're very interested in using time banking to address that need.
Okay, so I'm going to move us through to the I'm going to, if we could have the question, we thought before we went into the slides themselves, we just get a sense of how knowledgeable you are for those of you who are coming to this webinar. So if you could fill this out, I can see this is very helpful. So we're getting results right now. What it's looking like is some people, most are falling into the medium and low area of knowledge, and we do have a couple of people who are very knowledgeable. That's wonderful, and a couple of people for whom this is absolutely new. But most are falling bang in the middle with medium, a certain amount of knowledge, or just a little. Okay, that's helpful. Thank you. All right, I'm going to now move us into the first slide. This is about the need of caregivers. I think most of you will be even more familiar with that than we are, but Edgar, I'm going to hand this over to you at this point for the slide on the needs that caregivers have.
Well, the magnitude is indicated in the slide in terms of the millions who are giving care, and frankly, unpaid care represents between 70 and 80 or a higher percentage of the care that enables people to stay out of a nursing home. I've been on both ends of that care continuum because I started my work on time banking in the intensive care unit after a heart attack in 1980, and so people had to care for me, and I had to learn to recover, and people had to learn not to treat me as what I'll call a cardiac cripple. Then my late wife died of cancer, and I was her caregiver, and at one point actually had to be hospitalized because of the strain on me to cope with both earning a living and caring for her, and giving her the companionship and the sense of a vital and vibrant continuing relationship. So I think I know both ends of the spectrum, and I think that caregivers are in fact some of the most invisible heroes and heroines that we have, and their voice is not adequately amplified. But I think also that often they function alone and in isolation, and the notion that they need respite and they need a chance to get some respite and some piece of their life for themselves is part of what we're all here trying to say. How do we do that more effectively?
Okay, I'm going to move us to the next slide. This is about the supply side of what is available for caregivers. And you want to go forward with this one too, Edgar?
Yeah, well, this audience knows that the discovery of the need for respite came a little bit late. The Older Americans Act goes back into the mid-'70s, but it took a quarter of a century before the families decided that maybe the families that were providing the care and providing the unpaid care needed some attention themselves. even so it's been a late discovery, and I hope that as we begin to work together and begin to build new kinds of what I'll call extended families, that will be, frankly, not only a source of support, but also a constituency that wakes up Congress and wakes up the executive branch to the need for more extensive investment in this, because it's so critical. And I don't have to tell you that baby boomers are aging, and that means that the numbers will expand. And even though I've yet to meet a baby boomer who thought he or she was aging, most of them admit to having parents or partners who just might need some help.
And too, I'll just add to what Edgar said. I was just looking at some of the numbers too, and I saw in the materials that Jill had sent me that there are 11 million children needing long-term supports and care. So that there are huge numbers across the lifespan, and it is a massive need out there. I'm going to move us to the next slide, which is, oops, I've gone too fast. Try time banking. So this is just we'll give you a quick heads up about time banking, and then we'll actually go a layer deeper in a few slides ahead. So just very briefly, time banking is a way of rewarding people helping each other. So for every hour that you give help to somebody else, you earn a time credit. And it doesn't matter what you do, whether it's seen to be something very costly in the marketplace, like providing help with a will, which could cost you a mint of money in the marketplace, or something that would be very much less expensive in the marketplace, like walking somebody's pet. The time and the time credit is always the same. 1 hour is 1 time credit. And really what time banking does extremely well is by giving and receiving help. So people come to time banking to both give help and receive help. And that helps them to build relationships, friendships. A time bank can involve individuals, organizations, associations. It runs the gamut. So it's really a community building team as well that connects individuals in ways that they might not otherwise be able to do. And when people who've all often found themselves having to be in the receiving end of things, they get a chance as well to give. It's an opportunity for them to use their strengths and involve themselves in the things that they really love to do. We find that that can massively increase self-esteem and also save money and nurture health. All of these have been results that have been shown from successful time banks. So it says at the bottom here, turning caregiving scarcity into community-based, self-renewing supply. And that's what time banking done well has been shown to be able to do. So now I'm going to go to the next slide, which is time banking in action. There are over 500 community time banks. We've actually lost track because time banks most often use software, and they use different kinds of software. So there's no way now anymore of actually keeping track of how many there are. But we're quite confident there are well over 500 in the United States and Great Britain at least, and probably many more. And the kinds of help given and help received are very practical on many fronts: respite, friendly visiting, telephone reassurance, medical appointments, errands, transportation, bill paying, the sort of day-to-day tasks of everyday living, shopping, minor home repair. As well, though, they can involve less day-to-day things like peer support and counseling, and monthly social gatherings are a very, very important part of most time banks, bringing the members together to learn from each other about what they love to do, tell stories with each other about the things they have done. That's an important part of time banking as well. Edgar, do you want to add anything to this slide?
Yeah, I think that the most curious part of time banking is that regardless of the market value of the particular activity, the particular kind of help, that we have said all hours are of equal value. And for some people, that's peculiar because they say, well, I'm using skills that I learned, and why am I not getting more time credits for my time? And what we've really explained to them is that market price really deals with supply and demand, and so you have different prices for different things, but that what that means is that as a thing becomes more abundant, the price is lower, and if it's really abundant, it's deemed either cheap or worthless. And yet, and I suddenly realized, frankly, when I was in intensive care, that meant that all the universals that define us as a species, we have devalued because they're not scarce. Our ability to talk to each other, to listen to each other, to care for each other, to give each other a ride, just to be present in somebody else's life is probably the most valuable thing we have and is above and beyond market price. And that's why all hours are of equal value, and it's also why the Internal Revenue Service has decided that this is not barter, this is not a commercial exchange, this is in fact in the spirit of volunteering, but it reinforces volunteering.
Okay. Yes, I'll see that. I see there's a question there, which we will get to a little bit later on, but a very good question. So we'll take a couple of questions in a slide or two. So Lauren will be getting to your question shortly. I'm going to go to the next slide, and these are benefits that have been shown. This is actually these particular benefits are from a study on TimeBanks that had focused on providing care and help with seniors. So evaluations and the member feedback in that context was an increased sense of belonging, new friends of different ages and backgrounds and cultures, support for actually aging in place and not being institutionalized, improved, when it says improved mental and physical health, in actual fact, in these cases, everyone's mental and physical health was declining with age, but it declined less rapidly when time banking was involved than it did when it was not. Reduced hospital and emergency room use and shorter hospital and rehab stays. Some of this information also comes from an evaluation of hospital discharge program that was using time banking. A feeling that they can still contribute and a better quality of life. These are all things that have been found for those who are actively involved in time banking. And then here it says at the bottom of the slide, time banks are able to attract people who don't normally volunteer and keep older people healthier and cut the dropout rates of volunteers. We do often get the question, does time banking actually reduce volunteering? And actually what we find is that it does not. People who seek to volunteer are not put off by the fact that they're receiving credits for their volunteering, and it doesn't impact. In fact, it actually encourages new volunteers to join. So
yes, the Robert Wood Johnson Foundation actually did an evaluation to find out whether, in fact, it was just giving credit for hours that people were already doing, and what they found out was that that many of the people who were in the time bank had never volunteered or had ceased volunteering. I would also want to add that here in England, I'm finding out that doctors actually prescribe as part of what they call a social prescription. They prescribe people who are dealing with depression or hypertension or social isolation. It's included in their medical prescription for their patients, and then they go to either the nurse or to the time bank to fulfill that prescription.
Okay, so Emily, we are going to go to question number 2 because we're going to be moving into a bit deeper into time banking. But first, we'd like you to indicate which activities are most challenging for your organization in relation to volunteers, if you are an organization that uses volunteers. And please feel free to select more than one response. So a fair number do not use volunteers, and of those that do, it seems to be that recruiting is actually quite a challenge, that once you've recruited, training and managing and retaining volunteers isn't, so it's for either all of the above or the recruitment piece is the most challenging. So either there's it's just hard across the board, or there are some of you who find that recruiting volunteers is a challenge, but once you've recruited them, the training and the management and the retaining, that piece it falls into line, okay? Okay, but a fair number, as I say, do not have volunteers. Okay, thank you. All right, I'm going to move on now into the elements of a time bank. And I should just say before I go into this that time banking is very flexible, so it's actually very contextual, and each time bank really is shaped by the context, by the people involved with it, and by the needs it's seeking to address. But all time banks, we do stress the centrality of the 5 core values, which we will be going to in a minute. And time credits, we've already talked about those a bit, that it's an hour for an hour. A very, very essential part of time banking is leadership. And we'll be talking a little bit more about that, about the role of leadership in a time bank. Also, processes for giving and receiving and being together. I was reading the Arch manual for volunteering, and I was struck at how beautifully laid out all the procedures and the needs of really structuring volunteering were. Time banking doesn't have quite as much structure as that, and it can vary. Some time banks have very little structure, and some time banks have quite a bit more structure. And so getting the right level to fit the situation is a really important piece. And finally, time banking software, almost all time banks use time banking software because just keeping track of the data is an immense challenge if you don't have the software. So those are the sort of elements that go into making a time bank, a recipe for a time bank, you might say. And I will just move us to the next slide, which is the 5 core values, and I'll ask Edgar to introduce those.
One of the things that, as we began to develop time banking, it was clear that it was more than simply a set of isolated exchanges. That the first thing we had to know is what people could do and create, in effect, an inventory of all the capacity of people. Most of us in the human services are good at asking, how can I help you? What is your problem? But the problem is maybe 5 or 10% of who that person is, and we're often don't really know about the networks, the capacities of that person. But volunteers themselves need help and sometimes need support in order to be able to volunteer. I know a volunteer whose child brought home an algebra piece of homework that she had no idea how to deal with, but the time bank, she could look in the time bank to find somebody who had a teenage daughter who could help her child so that she didn't have to feel that she had to neglect her child in order to be able to provide help to somebody else. The notion is that we have an abundance of capacity that we don't know about. And if you put 10 people together in a room, they can do about 300 things, but you don't remember what they can do or who's available and who's not available, and you don't necessarily feel free to ask. But somebody can do drywall, and somebody can fix a car, and somebody can drive a car, and somebody can do hair, and somebody can sew buttons on a shirt, and somebody can be there just to listen and listen carefully. And so knowing who will do what and who can do what. So the first premise of time banking is that everybody has many more things that they can do than they know they can do. Most of us don't think that getting up in the morning and just putting on a shirt is important. But I remember one story from visiting nurses where a man had a broken leg and he needed help putting on his pants because his leg was in a cast and he couldn't put on his own pants. So the notion that we all can do things is sort of one of the first principles of time banking. The second principle, because we think of it as, in effect, a set of operating principles, because we're almost rewriting what I'll call the operating system for a community or for a family. And the second principle is the work we take for granted, work that's invisible, is in fact work that needs to be honored. And volunteers do much of that work, but the work that the market takes for granted, the work that money takes for granted, is the work that it takes to do something called raising children, taking care of the elderly, maybe making democracy work, making neighborhoods safe and vibrant, and maybe keeping the planet sustainable. So there's plenty of work that is not valued as work, but that in fact is critical to building community, building safe neighborhoods, and now, more important, building a new kind of extended family that's not biologically related, but that involves people who are willing to be there for each other in relationships of trust and friendship. What we have found is many time banks do not use police checks. When you're dealing with elder care and you're dealing with child care, you have to do background checks. But in over 30 years of time banking, we've had millions of transactions, and I can say that there have been, nobody has robbed the time bank of good deeds or good hours, and this doesn't seem to be a place where dishonest people or people whom you can't trust want to be part of, because every action leaves a footprint and every action is remembered. And so the second principle is that we have to, in effect, begin to value work that otherwise is invisible. Chris, should I keep going speaking?
I think if you could speed it up a little on the last three, that would be a good thing.
The third principle is reciprocity, because we don't want giving help necessarily to create unnecessary dependencies. And when we help a person, we say, what do you need? And you help them. But if their only asset, if the only way they get attention is by having needs, we're in effect saying to people, that's the only thing that will get you my attention. And we're interested in saying to people, but can you pay it forward to help somebody else? Now, that may not be true when a person is the caregiver, but often after they have given care and after they have lost that person, they want to pay it forward in some way. So the third principle is reciprocity. We ask people to pay it forward when they can, as best they can, in any way they can. And maybe they can't pay it forward, but maybe they have a child or a relative who can. The fourth principle is we call community. It's really interdependence. We keep being told you pull yourself up by your own bootstraps, but in fact none of us came into this world pulling ourselves up by our own bootstraps. And I think that the notion that we need each other is a fundamental lesson that we have to reinforce and reiterate. The last principle is respect. And that means that not only is everybody owed respect, but even people and even unheard voices need to be heard. The voices, we have to ask ourselves not only why are we here, but what kind of a world do we want to try and create. And so in some sense, we are stewards for all that we receive from those who came before us, and we are trustees for the world that we're going to try and create, so transmitting those values. And those are what we call the operating core values of time banking. So the time banking is not simply a set of unrelated nice deeds, but in fact it is in fact really standing up for and choosing to live by fundamental values and fundamental principles, so that even walking a dog is a statement, or even doing somebody's hair, or even just being there listening represents a statement about value, and is part of a much larger movement to say we have to recover and the core values that we know are above and beyond market price. Chris?
Yes. Edgar, because you can't see the questions, I am just going to read out a few questions. I'd like us to just go to one more slide, and then we should take some questions, and then we'll go through some more slides again. So I'm going to read out some questions, Edgar. This is one. What, from Lauren, what if the care recipient has medical needs? I've been trained in CPR, a lot of first aid, intramuscular subcutaneous injections, and 2 rescue resuscitation meds. And I can only leave my daughter with a nurse. So that is one. Another says, how do you vet volunteers? And another, do you do background checks? And a third is, how have TimeBanks been started, and who needs to be at the table? So just so you know, those questions are there, Edgar, and we'll be getting to those shortly. So I'm going to take us to the next slide. And this is actually, I'm going to whip back for a moment to the slide about the elements. We have the core values and the time credits. And the next one is the leadership, leadership that supports and encourages. It really, the person who said, how have TimeBanks been started and who needs to be at the table? That is a really good question, and that speaks to the importance of leadership in a time bank. I've listed here that it takes the caregivers, the volunteers, the service providers, the programs and managers, and the funders. It really is something where you need to have really buy-in at every level. One of the things that we found early on was that if TimeBank was just seen as only involving the community but not involving an organization that was dealing with the problem at hand, be it aging or juvenile justice or some other program, that the divide between what was going on in the time bank and what was going on in the organization became an insurmountable problem to deal with, that there really needed to be strong buy-in on both sides, on the informal and the more formal supply of care. So it really does take, it takes a small group of passionate people who are then going to actually get that buy-in from the different areas of people and personnel who are going to be involved in one way or another at the time bank. And I left one level out of here. I've put caregivers, volunteers, service providers, programs and managers, and funders. All of these need to be saying, yes, we support this. But also, in many cases as well, the individuals who are receiving care can also be involved in giving and receiving time credits. And we don't have time to go into this right here and now, but in creating a time bank, obviously it's going to be seen differently from each of those players. The people receiving long-term services and support and the caregivers are going to see this somewhat differently from the volunteers, and it's going to be different again for the service providers, the professionals who are providing care in other ways. and different again for the programs and the managers.
Leadership is also a tricky question, a tricky issue, because we're not talking about normal hierarchy. We're talking about those people who know the community. I remember when I was in Tennessee, an older gentleman said, "Edgar, we used to have that kind of leadership, and then we got air conditioning and everybody went inside. But it used to be that people would sit on the steps and they would know the community and know the neighborhood. And the leaders are people who have a warmth and a trust and and they come to have a kind of knowledge as to whom you can depend upon and and also they also know when a person's been through a crisis often and shouldn't be sent in. I have urged in some communities that respite be done by teams, that you send in two people to do respite, because in some cases where you're dealing with dementia or other problems, you don't know what the person is going to say about the person who came to give respite. And respite requires not only training, but it requires relationships of trust. And it's a little bit scary at first to walk in and say, "I'm here to give respite." So the whole process of giving respite involves training, and it involves an awareness that different kinds of skills are appropriate to different contexts.
So to speak very directly to Lauren's question, saying that Lauren needs a nurse, you can only leave your daughter with a nurse, we would not be suggesting that a TimeBank member would replace the nurse that you could leave your daughter with, but that there may be other ways in which you could get respite that would be helpful for you, that would be a support for you. So in that case, it's the blend of formal and professional supports and informal caring and supports from the community. So in the situation, for instance, with the discharge from the hospital, there's this constant partnering really between the formal system and the informal system, and it required two full-time coordinators in that case in the hospital discharge program, Lehigh Valley Hospital in Pennsylvania, two coordinators to keep bridging that formal, informal, those different domains. So the one coordinator would be very familiar with what was going on in the community, and the other coordinator more aware of the more formal aspects of what was needed by the hospital and the routines of the hospital and how to fit those in together. So they formed a team. So that is a very useful example, I think, of the ways in which time banking can be adapted into different situations. In that particular case, they've actually been doing, working with what they call super utilizers, people who are the most heavy users of hospital services. And they have been quite successful in the Time Bank as active members of the Time Bank as well. So
I think also one of the critical issues for caregivers is their own isolation, and we know that social isolation really affects not only a person's mental health but also their physical health. And just having somebody come in who's there to care and to talk to and to do, and maybe to do errands while or enable the person to have a little bit of private time is just of critical importance. And that's why what the Lifespan Act does is so very important to the well-being both of the person receiving the care but also to the caregiver.
So Lee asks, how do you vet volunteers and do you do background checks? And again, this is actually not, this is up for each time bank or each time banking program to determine what is appropriate for their needs. So it's really, I'm going to take us to the next slide because this is the appropriate place for this, that for buy-in, build practices and roles and rules that connect and are a good fit with what is already working. So in a situation where the background checks are already a part of parcel of having volunteers, that practice would just continue with TimeBank members. Or you may decide that, there are some areas of being involved, helping with each other, where we don't need that level of background check. We can ease back on that on, say, community events or something like that. But there has to be a fair amount of planning that goes into setting up a time bank, determining what you want to achieve with the time bank, what kind of activities you're going to do, and that all then goes into determining how stringent will be things like background checks and so forth. I'm just going to talk to what in a regular time banking situation is called for in bringing in members rather than volunteers. So many time banks are neighbors helping neighbors, not in a specific situation of meeting a specific kind of need. And other time banks are very focused on meeting a specific kind of need. In the time banks that are neighbors helping neighbors, just building a sense of community, the sort of core practices and roles are around getting that leadership team going at the beginning. And it can be just 2 members of the community, no more than that. You always do need somebody who's very, very good and outgoing and connecting, a good connector. And then you do need somebody else who keeps an eye on structure, on what are we going to do in sequence, what's our enrollment form going to look like, are we going to have a manual, and how is that manual going to look, and so forth. So most time banks start up with a small team of 5 to 7 people, but we've seen very successful time banks start with just 2 people. It really takes more than one person to start it. It takes a team. And then the things that the team will be setting up are things like the outreach, the enrollment, the orientations, because people do need to be oriented to time banking, the exchanges between individuals and groups, the celebrations and the gatherings to kind of anchor what's happening, and then the feedback and the evaluations, which can be quite informal or very formal. So if you're looking at this and you do have a volunteer program, you would see this is it maps onto bringing on volunteers. The outreach, the enrollment, the orientation would be orientation and training, and the exchanges would really be volunteer activities. And then, of course, the celebration of the work that's done and the feedback and evaluations, those all map onto volunteer efforts. So in any one situation, a time bank could be oriented to very, very informal care and support, or it could be oriented towards more formal kinds of more heavy-duty volunteering roles. And in each situation, the people who begin the time banking would determine what they would like to do with time banking. It really is a tool to lay onto or integrate into a time banking, a volunteer program.
Also,
Edgar, would you like that?
you're also changing the healthcare system in some sense by understanding that if you don't engage the whole community, then you're limited to what Medicare and Medicaid will pay for. We've had professors of social work who have used time banking as a vehicle for structuring a practicum. We've had high school teachers whose teenage students have been assigned community service to work with a time bank. And so this gives you a tool to recruit a new group of volunteers, because it adds a different kind of structure and a different kind of intellectual content to what the volunteering is about. In some sense, if there are now lots of courses on aging, but wouldn't this be a superb practicum to have a time bank, because it would generate the hours, but also it would generate learning and reflection. So I would say when one says, how does one start a time bank, this gives you a tool for recruiting volunteers around an objective and a purpose in terms of the significance of informal care and the significance of both the limits and the significance of the formal care system.
Okay, so I'm good. There's another question here, and then I'll just take that question, and then we'll turn it around and put two more questions to you. So the question here is from Lee Schroeder. Have you seen success with time banking in rural areas? And Edgar, you want to take that one? I also would like to respond to that one.
Well, I think it was North Dakota or South Dakota, it was used particularly as a vehicle for dealing with issues of transportation, but also dealing with issues of isolation. And then we've seen it used on Native American reservations, and it's engaged the elderly there. I think Allentown reaches into rural areas in western Pennsylvania. So yes, it's because rural areas, the isolation is greater, and transportation and just knowing and gathering a cluster of people, time banking is a very useful tool to use in rural areas.
And having said that, I will also add that it is more challenging. The distances do make things more difficult. So I was just talking with a coordinator who is involved with a rural time bank in Maine. She does her orientations actually online. She doesn't have group orientations as most time banks do with people coming together and having an orientation. She does them online. But that's working just fine. So there are workarounds for the distances between people, and it is working for her, there in that rural area. So yes, it can definitely work in rural areas, but it's more challenging to be sure. And workarounds for some of the things, like the monthly gatherings, not so easy to do when people are very spread out. So
one of the incentives, yep, though, is that it builds a resume of sorts. So if a person who has not worked is coming into the workforce, building a track record that is both documented with references of the people whom they've helped can often be a way of supporting reentry or entry into the work and into the job market.
I am going to now, this just is a reference to the software. As we said earlier, time banks routinely use software because the data, storing all the data would otherwise be prohibitive if you're trying to do it with pencil and pen. And sometimes some time banks also just use notes. They've done that in the UK where they just use notes. But 99% of time banks use time banking software. So
if you have to leaf through 200 index cards to find somebody who's available Tuesday night, time banking would not really have been possible. It was really the advent of the computer and the ability to store data on who can do what, who's available, what their contact information is, and the ability to contact them. And now as the software becomes available and usable on smartphones, it no longer is just concentrated. The database is not only in one computer, but the database is available to the whole network to begin and that provides a form of reinforcement that strengthens the network.
So, Emily, we're going to do the final two questions. And question number 3 is, do you think it okay to ask caregivers in need of respite what they love doing, if they have opportunities to engage in that, if they might enjoy helping others, all of the above or none of the above? So that seems to be, so far, We have no response to what they love doing. That may have been a bit vaguely worded, but if they have opportunities to engage in that activity, just a few, most have said all of the above. So that is really lovely to see that. That's very heartening to see that. The next question is, do you think that the majority of your volunteers would be interested in receiving time credits for the work that they do? Yes or no, or not sure. So this is, we have about 2/3 saying yes, a small percentage saying no, and 1/3 saying not sure. That's where we are with that. Edgar, do you want to comment on people receiving credits?
Well, there's no reason why the person receiving care can't engage in things that would earn them credits. And I think as a restorative strategy, that's important. I've been meeting with people here, and they say, well, people may be bedridden, but they would love it if Skype would enable them to engage in conversational English with somebody in China who wanted to, or if they could read stories to children across the world. Wouldn't that be wonderful? Couldn't they earn time credits doing that? Then another person said to me, well, a person may be bedridden, but they know how to do origami, and they can show origami. So the capacity of people who are receiving the care, as well as the needs of the caregiver to provide support for children or for others in the family whom they're in effect neglecting in order to be a caregiver, this provides them with a different kind of extended family and a different set of resources. And so people started talking about the different things both that caregivers themselves need that they don't have access to, and that the person for whom they're giving care may in fact want to, in order to live their lives meaningful, do something for others, and the Time Bank provides them with a network whereby they can do that.
Okay, so we have a comment from Rachel Hiles. You can use a new tool called Thinkific to host training for volunteers, and sure they've completed the course and administer quizzes to make sure they've paid attention. And Susan Robinson says, you imply that people would volunteer outside of their own time banks. That seems idealistic, but not quite like serving fellow members.
Well, the Time Bank can take on a project. For instance, it might take on a project that says nobody coming out of hospital will be without an errand service for 2 weeks. Or we want to make sure that everybody in this block with older housing has insulation in their windows in winter. Or we're going to take on shoveling snow as a time bank for the whole block. So yes, a time bank project, a time bank collective event can make a huge difference both for caregivers and for the families that are living on that block.
I think, though, that Susan raises a very interesting point there about members and non-members. And what some time banks have done is they actually have what they call a community pot. And members of the time bank, contribute to the community pot. And that community pot can be quite open to non-members receiving help. So there are ways that time banks actually design into their structure ways to extend beyond their members. A lot of members will actually earn way more credits because they enjoy giving. We find that people come to time banking tending to be more givers than receivers, or in most cases. And one of the challenges is actually finding people to receive credits. It takes a while to get used to receiving help. It can feel a bit strange at first, and in fact that's one of the challenges of time banking, is shifting from being one or the other into fluidly being both a giver and a receiver. The community pot, or people give it different names, but there are ways to actually distribute time bank hours into the community because is a surplus of hours very often. And the other thing that people will give time to and need to give time to is the time bank itself. And for instance, the Crooked River Time Bank has now become 5 sub-time banks as it's spread and grown. And I was speaking to the volunteer of Crooked River, and she said they are thousands of time credits in quotes, debt. And it's not really so much that that's in debt at all. It's just that people volunteer their time, essentially, but their time is tracked, and so it counts as credits. And so it's an investment in the time bank because the time bank does need structure. And as earlier I pointed out, it opens up many, many opportunities for leadership, very creative leadership in the informal realm. But so yes, it's true, Susan, it is idealistic, but it does actually happen a lot, that people do want to give beyond the boundaries of the time bank. I think a lot of this, too, is that time banks set up a kind of culture when they're formed. Their sense of mission and what they're about and how they're started is a very important moment, because in those early days as a leadership group comes together and says, what is this time bank about, there are opportunities to really sort of anchor the core values and to anchor that this is a kind of volunteering plus. It's not about just having a different kind of money. It's really about giving and receiving in a very generous way. I have completely lost track of time, I will have to say. And Emily or Jill, where are we at?
It's about an hour now.
Yes.
We have about 25 minutes.
Oh, great.
Remaining.
So we have a good amount of time for anyone who'd like to actually ask questions. We did not get into I will say that we did not get into the how of time banking very much in this webinar, because the how in many ways is very much like setting up a volunteering program. It just leans more into informal supports for people, and it leans more too into individuals stepping forward and proposing ways in which they would like to help each other. But it does not have to only do that. It can also be quite structured to have very specific volunteering opportunities for which volunteers can earn their time credits. So have time banking hours ever been used as in-kind match for grants? This is from Jean Sherman. I am very sure that they have. In fact, I know they have, but I'm sorry I can't give you a chapter and verse on that. But I'm thinking of the Dane County Time Bank. I remember having a conversation with that time bank. That is one of the most interesting time banks in the country because it does so many different kinds, grown to include so many different kinds of programs within it. So they all interact. So they have youth court and keeping fit for seniors and help in the schools and on and on and on, all interfolding with each other. And I'm pretty sure that they use time credits to get additional funding for the work that they do.
When it was being used in the healthcare realm as in-kind match, it was valued at the national average value of a volunteer hour, which back then was $14 an hour. I'm not sure what it is now, but they used that. They quantified those hours as at whatever the volunteer rate was, and that fulfilled their obligation to the foundation that required in-kind match. I think in other cases, the programs themselves would not be successful without that match. You have to say, how do you involve the people? For instance, the Caregivers Foundation asks, how are you involving the people in the program you're planning? And so time banking is often used in grant proposals to show that you do have engagement and you do have a strategy and a vehicle for engaging the people whom you're trying to help as partners and co-workers in the design and in the implementation.
Oh, there's a very interesting comment here from Susan Robinson. I guess I've always thought of it more of a tracking system, and people give while they can, and then they come back years later to draw on it. One issue that always struck me was if the bank would still be there when people wanted to draw on their banked hours. I'm hearing that it is more current kinds of, hang on, I'm needing to go down, there's not room in the, that seems, nope, that's not. More current kinds of exchanging. So it can be either, actually, Susan. There is a time bank in Annapolis, very close to us here, called Partners in Care, which has been running now for, I believe, 25 years, something like that, 20, 25 years. And indeed, that was run more on the model where when people were younger, they volunteered to help, and they earned credits for their volunteers. And then as they got older, they started to use the time bank to get their support. And it was really sort of seen that way, that it was much more about over a long length of time. But I would say that actually is not the most common. More commonly, it's done that people are earning and spending within weeks or months at the most, but not over a period of years. So it's more current.
That's true now, but in terms of the future, it's interesting to note that when time banking was originally started, it was called service credits, and the state of Missouri actually enacted a law that funded service credits, but it also said if the program goes out of existence, the state will stand behind it and will give preferential access to its own resources and its own services as a way of backing the service credits and standing behind it. So we may be thinking, as we think about the future, it may very well be that the programs go out of existence, but that some kind of reserve system needs to be set up in different kinds of ways to stand behind those credits that people have earned, that they won't need to spend for some decades even.
Okay,
this
so
is Jill, can I sneak in a quick question?
Yes, please.
Since I have the phone. You've given a lot of great examples of time banking, and I think it would be very useful to the listeners if we could have somewhat of a good detailed example of a time banking that's actually being used for respite and or caregiver support specifically. I know there are some because I've heard from them, so I know they're out there.
Edgar, I'm handing over to you because this is, yeah.
I think the most explicit example I can give is the use of time banking by Arch Care in New York City, which is not known to be a place where strangers trust strangers, but they were originally part of a social HMO in Brooklyn called Elder Plan, and what this meant was that people were receiving health care, but they also were eligible, if they joined the time bank, to receive any kind of help they needed. And what the HMO found was that this created a loyalty to it that prevented them from being raided by other HMOs. It then moved to the visiting nurse service and had 3,000 members, generating hundreds of thousands of hours each year. And it wasn't specifically medically related, but it created a sense of community, and they were scheduling regular events because the monthly gatherings brought people together and created a different kind of a connectivity. And one of the things that people always tell us about TimeBanks is we met somebody whom we never would have met before, and we now have new friends, and we never would have met them except for the TimeBank and the gatherings that the TimeBank had. We're now seeing the same thing with Arch Care in New York City, where it's now being it's now being much more integrated into actually and linked to providing the support services needed to prevent institutionalization. Am I still on? No.
Yes, I see a few more questions have come in. From Rachel Hiles, she asks, who are the main drivers behind these time banking initiatives in their communities? It seems like faith communities and their networks could really make these happen. And Rachel is from Missouri.
So I'm going to jump into this one, Edgar, and just say we would love to see faith communities and faith networks make these happen. It's been an interesting challenge on that front because many faith communities, it's a very deep-seated part of their faith that you give without thought of receiving back. And so time credits fit sort of a little oddly into that belief framework. And we've really, there are churches, there are faith communities around, but it's not been easy for faith communities to pick up on time banking. It's not a prominent part of time banking, and we keep thinking one day it's really going to take off on that front, but we haven't seen that happen yet because of that particular hurdle, which is this getting over this idea that you are going to receive as well as give and give as well as receive. So Rachel, if you think your faith community would be able to do it, that would be a wonderful thing. Rachel also added, could someone make a financial donation to a time bank for credit? So it doesn't actually work that way. The credits are always for helping each other and doing things, but you can actually, so the donations are just donations of funding that support the time bank. We try and keep the money side and the time credit side sort of distinct from each other. So money and time credits don't interchange with each other because, in part, this is because we've kept time banking so far tax exempt by being very careful about that and saying it's just an hour for an hour, and so time credits remain tax exempt. Edgar, do you want to add to that?
Yeah, I think the one thing that we've avoided doing is putting a dollar value, is creating any kind of conversion of time credits to dollars, except when organizations that run it need to come up with in-kind match. But they can't. But if time credits get to be, quote, for sale, for exchange for money, we not only have the IRS, but it really violates our commitment to valuing work that the market doesn't adequately value, which is everything from child rearing, which is not, to caregiving, to civic engagement. There are some time credit, time bank organizations that mobilize the community to protest something that the municipality is doing or not doing. So it's civic engagement, it's caring, it's environmental protection, but it's not. It can't be converted to dollars.
Patricia Witt has written, we actually have a time bank here in Tacoma. I think that we may have visited that time bank in Tacoma, actually, Patricia. And it was started as a pilot with a faith community. And I'm very curious, how is the time bank doing over there? Oh, can you type in a response to that? I'd love to know. I see she's typing. Patricia is typing.
This is Jill again. On that note, too, I would love to hear from either now or by email for those of you who are on the call and you're with an agency that's currently using TimeBanks for respite or family caregiver support. We would really love to start keeping a database of these programs and be aware of the fact that you're out there doing this. And I know I heard from someone this week in Nevada, I believe, who let me know that I believe it was an area agency on aging that was using TimeBanks to provide caregiver support. We would love, love, love to hear from you and the details about the services and the way that your program works. It would be really helpful to us. Hawaii's Lifespan Respite Program did a very wonderful feasibility study on using TimeBanks for respite. Unfortunately, they did not get a follow-on grant that enabled them to implement that implementation study. But I think that document could be very useful also to those of you who might be interested in time banking. And we will make that available on the website when we archive the webinar. And I sent it around prior to the webinar as well. But again, if you're providing time banking, if you're providing caregiving or respite with TimeBanks, please let us know.
Yes, we would be interested to know too, because really this is an area that's time banking is so interesting because it's sort of being pioneered. I'll describe it as that in many different areas, and respite is one that is still forming itself. The Partners in Care does respite in the way that I described earlier, where people who are younger give help and later on receive help more. It's a more spread out version. The Arch Care has a team. Is it of about 5? Does Marcy have about 5 employees, Edgar? She has a professional team, and it's folded very, very intricately into the provision of services as well. So finding the right structures and sharing good practices around different structures is something we're very keen. On Sunday, there's actually going to be a coordinator call. This is for existing time bank coordinators, but not this Sunday, but next Sunday, for time banking that is involved in medical care. So we're actually doing it on a Sunday so that we can have a participant from Britain. There's going to be a coordinator from Britain join in who's been running a time bank in London. This is the time bank where they actually provide prescriptions in time banking. He's going to be on that call. So we are definitely developing practices in these different areas, but we are sort of needing to keep building up our communities of practice and share learnings between the different time banks as to how they're doing this, how they're building, what structures they're using, what processes and policies. And we act as something of a clearinghouse, but it would be wonderful to have Arch receive information about that.
There are 2 other uses of time banking that may be complementary. One is in New Zealand, it was critical in dealing with the earthquake and natural disasters because government services went down, but people had the internet and they had each other, and that was what notified people about where it was safe, where the kids could get food, what roads were repaired. And so we see it as something that can be a critical backup for first responders, or in some cases it was in Miami with Hurricane Andrew. They were the first responders, and they had to educate the firemen and the policemen and the National Guard as to where the people were, because the time bank folks knew as the residents. The other use that I'm hearing about in London is that it's being used to knit refugees together and find ways in which they can link with the larger community. And as we have more and more people coming into this country from other countries as refugees or asylum seekers, this may be a useful tool for people to know about and to use.
But going back to the respite front, as I was reading, I am not myself very familiar with respite. So I really read the manual that Jill sent me with great interest. And I could see that there are really, and this speaks to Lauren's question at the very beginning, there's a real need for people with in-depth understanding, in-depth training of the volunteers. It's very focused and targeted, and I think that getting TimeBanks to have that focus, it fits beautifully, but it needs to be really well laid out and specified. And we have not, there is Marcia's program, but more generally in the network, I would say we haven't developed that level of knowledge about doing this, so that TimeBanks that would go more heavily into respite will be in a sort of learning and teaching mode for the rest of us.
Well, hopefully you'll have the individuals who have the expertise in providing respite and caregiving support actively engaged in the development of the TimeBanks. I mean, you wouldn't want it to be done by,
yes,
by those who
absolutely.
are part of the community.
Absolutely. And we sometimes call time banking volunteering plus. So if there's already a volunteering program in operation, then it would be a conversation about how then to use time credits to strengthen it and to maybe add some pieces to it that couldn't be there without the time banking. So yes, indeed. But we would love to learn too, Jill, about time banks that are doing this.
Well, I've been keeping in touch with Edgar about letting all of you know when we hear about a new program, and maybe we'll follow up this webinar. If we hear from a few TimeBanks that are actually providing caregiver support that might be willing to present or share on a networking call.
That would be brilliant.
We are coming into the last few minutes of the webinar, and I want to be respectful of everyone's time. I do want all of you to know that I believe both Chris and Edgar are going to be at the 2016 National Lifespan Respite Conference in Denver, doing more of a hands-on kind of workshop. So if any of you are going to be there, you might want to make note of that. We're very excited that they're going to be participating. Did you have any last-minute points you wanted to make, Chris?
No, I think I'm good.
Well, one of the most interesting things is I've talked to people here, and their focus has been on helping individuals who have disability, and how to create support for the caregivers who are doing that. And they had defined their purpose as one of dealing with happiness. And so I shared with them something that they seemed to be struck by, that there are two components to fulfilling a person's desire. One is for happiness, which is about meeting present needs, and the other is about meaning. People are motivated to give meaning to their lives, to look at their lives and what they've given. And I think what time banking does is it deals with both dimensions of a person's need, a need to deal with present needs, but also a need to feel that they really matter, and that their lives are part of something that's bigger than themselves. So my hope would be that we would think about both the happiness and the question of meaning, because those are two separate but critically complementary kinds of energy.
Yes, absolutely. Thank you for that. With that, I want to thank our two speakers for taking the time today and really giving us a very insightful and inspiring presentation. I think we've got a lot of interested folks out there who are going to want to follow up and see what TimeBanks is all about and how they can implement it in their communities. So thank you both very much. I also want to just remind our participants that when you disconnect from the webinar, you will be seeing a link to an evaluation survey, or you will be receiving it via email just a few minutes after the webinar. So please just take a minute to let us know what you thought about today's webinar and how we could improve webinars in the future. And if you would like to let us know about your own activities in this area, we would love to hear from you. So thank you all very much for your time, and thank you, Edgar and Christine, again for such a great presentation.
Well,
Take care, everyone.
It's been a pleasure.
Safe travels back, Edgar.
Thanks so much. This is great.
Take care, everyone. Bye-bye.